Thank you so much for inviting me today. I can't really think of a time more important than this to talk about humanism in medicine. I think, first of all, even before the events that happened last week, when you think about just this past year in the way we talk about immigrants and migrants, what we've dealt with in the last 10 years in the way that the government talks about immigrants and migrants, we need humanism in medicine to heal us and to allow us to move forward and create programs that really counter the negativity that is so deleterious to the children and families we take care of. So I also want to just acknowledge, as Dr. Orange did, and thank you, Dr. Orange, for the introduction, that this has been a really tough week for all of us. And I would be remiss not to mention how painful it has been for all of us to see the events unfold. And I think of the work we do as so much healing. And so I hope that this lecture, even though there is, and I should give a warning, there are some pretty ugly stories in this lecture that might be hard for people to hear, but we need to hear them because we need to understand who migrants are. Migrants are not migrants, they're human beings. And we have to think about them as human beings, and we have to think about the stories behind who they are. Otherwise, none of this matters, and it's all just very abstract. So let me just start with that. So I have no disclosures today. Let's see if I'm doing this right. Okay. Here come the first typos. So today, these are some of the objectives. We'll review a social justice and humanistic framework for caring for migrant populations. I want to give you a little bit of a framework of actually how we work with the migrants that we see in our program, the different phases of migration and how that impacts not only their health, but their legal outcomes. Understand the medical legal nexus and how doctors and lawyers can work together to improve outcomes for health and immigration outcomes in court. Teach you a little bit about the program that we developed 10 years ago. And we'll talk a lot more about that in the workshop as some of the staff member who are doing the work day to day will be here, including Brett and Sarah, and one of our social workers, Lisa Pineda, and one of our pediatricians, Perry Nagin. And then we'll just talk a little bit about advocacy. So I have a Steve Miller story, actually. And when I was a resident, when I was an intern, Steve was my senior resident. And again, like being on the wards in 1988, I guess it was, 87, and I see one of my mentors, Terry Marks here, who was actually my very first continuity care preceptor. Hi, Terry. And at that time, 50% of the pediatric wards were filled with children with AIDS. It was really quite overwhelming for all of us. And I remember one night, it was a quiet night, and Steve, instead of us just rushing to go to bed, which we almost never had time to do, Steve was like, "Hey, Alan, what do you want to learn?" And I was like, wow, like he was so amazing. And before I could even answer, he goes, "I'm going to teach you about renal function." And I was like, wow, he really knows my weak spots. And this was a time where like every kid had multi-organ failure and problems, and it was just so overwhelming. And he just said, let's sit down and learn about renal function. And I thought that he'd probably be a little bit annoyed today that I'm not actually giving a talk about renal failure, but I'm not. But his generosity was so, just like one of those moments, you think of all the nights you've had during your 3 years of residency, that night was one of the nights that stands out in my mind. And so for me to be here and being honored to be able to speak on this day means so much to me. So thank you to the Meyer family and to the Miller family. So I'm going to start today with a framework for talking about our work. we have to put our work in some kind of framework. And this framework of health equity, social justice, immigration, human rights, and humanism in medicine allows us to sort of design our programs, whatever type of programs in primary care, in hospital-based medicine. We need these principles to be able to really design programs that treat our patients with dignity and respect. And I can't emphasize that enough. I'm going to use some stories today to tell you about sort of some of these principles and highlight why it's so important that we approach the work we do. And I really will focus today's work, even though it's applicable to all the patients we see. But I'm going to talk about these principles in light of the work we do with newly arrived migrants. And I'm sort of making a slight distinction between immigrants who are in this country and living in this country to newly arrived migrants who have maybe one more level of need. So I'll start with the story of a boy I took care of who first came into our clinic when he was 17 years old. And he was a boy that came from an indigenous mom community in Guatemala. At about 15 or 16, he was hired to work in a coffee and cardamom plantation. He soon learned that he was not free to move around as he pleased, that he was not free to leave the plantation, and that all the workers were guarded by men with rifles 24/7. And not only that, he was actually not earning any money. So in essence, he was put into slavery. Of course, what soon came into his mind is how to escape. And he would think about that all the time. But then one of his coworkers escaped. And that coworker was caught and brought in front of all the workers. And I know this because he told me the story himself. And the workers' hands were cut off in front of all of the workers, which sent a very strong message to the rest of them: you cannot get out of this situation. So for him, this put him in a really horrible crisis. And he had to make the decision, am I going to perish in this plantation, or I'm going to be resilient enough to leave? And he chose the latter. So one night there was a party going on at the plantation with the workers. Many of them got drunk, and he was able to escape. He climbed through the jungle for about 17 hours until he reached his village. At that point, they already knew he was gone. The village was alerted that they were looking for him. And with the help of the village, he escaped and came to the US border. Upon apprehension, he was put in detention. And most kids stay in detention for about a month, a couple of months at most. He was kept in detention for 9 months, which of course added to all the trauma that he previously had. And he couldn't get out of the detention center or the shelter. And I'll talk more about what that system is later on, because his brother, it was hard to get his brother as his sponsor. Eventually he was released and was referred by his immigration attorney, which he was able to get, to Terra Firma. And at that point, we saw a boy that was incredibly traumatized, could barely talk without breaking into a sweat, and really required very intense care. So I want you to think about Jose and some of the other stories I tell you about when we think about the principles that go behind our work, and how we think about migrants and immigrants as human beings, and all the things that happen to them before they actually are in our exam rooms. So we'll start with health equity, and I'll just read this to you. Health equity is a state in which everyone has a fair and just opportunity to attain the highest level of health. Achieving this requires focused and ongoing societal efforts to address historical and contemporary injustices. However, overcome economic, social, and other obstacles to health and healthcare, and eliminate and prevent health disparities. Health equity acknowledges and addresses racism as a threat to public health and the history of unethical practices in public health that lead to inequitable health outcomes. So this is very important for us. This is sort of the crux of what this lecture is about, and about the work that we're trying to do. This is an example of how we don't see health equity in this country. So this is a map produced by National Immigration Law Center. And it shows the states that now in 2023, of August of 2023, provide state health insurance or CHIP to children regardless of immigration status. So really up until just last year, there were only 6 states plus DC that provided that care. So more recently, some of the other East Coast states, New Jersey, Connecticut, Rhode Island, and Maine have now accepted children into that program. Having health insurance means access to care. So without health insurance, it's a huge barrier to getting health care. And if you think about how crazy that is from a public health perspective, think about that all of these children, every child in this country has a right to a free education from K to 12, regardless of immigration status, right? So you're putting kids into school that don't have health care. And does that make any sense? And just think of the pandemic as like the prime example of how the lack of health insurance and lack of access to health care was devastating to this country and devastating to the communities that were most affected by not having health insurance. So let's turn to social justice and immigration. And this is really a way to address social justice, maybe better than even a definition, which might include access to resources, equity, participation in society, diversity, and human rights. So this is sort of a way, this is the Ford Foundation, it talks about it as race, gender, class, disability, and ethnic identity are intricately connected and actions to change this must shift repressive power dynamics and strengthen the rights and influence of those most affected by violence, oppression, injustice across the globe. So just think about the first story I told you about. The human rights of immigrants and asylum seekers are threatened by the erosion of asylum and a system that combines immigration and criminal law. We have yet to come up with a comprehensive immigration package in this country that treats immigrants with dignity and respect, even though that we want them to work in our farms, in our factories, to clean up disasters, et cetera. Human rights offers a framework for protection of people's human dignity, freedom, health, and quality of life. And this comes from a great article in the Journal of Human Rights and Social Work. So let's turn to human rights. Now, I could have spent the entire hour or the entire week going over these declarations, but I just took a few of them to really highlight our work. So the universe, and to think that all of these declarations and all of these covenants came out of catastrophic events, war, genocide, maltreatment of children, massive refugees, migration around the world. That's where these come from. They don't come out of the blue. So the Universal Declaration of Human Rights in 1948, right after the Holocaust, recognizes the fundamental human rights to seek asylum from persecution in other countries and the right to be free from arbitrary arrest, detention, and exile without due process. Just think about how immigrants are treated in this country. And we'll talk a little bit about the lack of access to immigration lawyers and the way that they're treated once they are apprehended in this country. Or the International Covenant on Civil and Political Rights, passed in 1966. By the way, the US has not signed any of these declarations. That states that immigrants and asylum seekers have the right to due process and legal representation. That is not what exists in this country. And lastly, and really close to home, the Convention on the Rights of the Child, passed in 1989, Article 9.1, that says, you shall ensure that a child should not be separated from his or her parents against their will, except when competent authorities subject to judicial review determine that such separation is necessary for the best interests of the child. So here's some of our policies at the border. And what you'll see here are policies that were developed to contain and to deter migrants from coming to the border. And you'll see in a graph I'll show you later on how none of these work. If you're running for your life, if you're under existential threat, a border wall is not going to make a difference. knowing that you're going to be in a detention center for a long time is not going to make a difference. Even separation of children from their parents has not made a difference in terms of the flow of migrants to this country. So none of these work, and all they do is harm children and families and all the migrants who try to cross the border seeking humanitarian protection. And if you think about the Bill of Rights, you could see like how wrong all of this is. And this is just a list of just some of the things that we do. I'll just go back a minute to say in 2017, 2018, they started, when Remain in Mexico was put into place, they put that so that only migrants who come through ports of entry, of which there are very few on the border, can come in legally. So what that did is look at where the line, the vertical line, the dotted line, that's where Remain in Mexico was put in place, and metering, where migrants themselves were in charge of putting a list of migrants together to go to the border patrol stations. Look how the numbers just increased of crossings in illegal in spots that were not legal ports of entry. So I can't help myself to remind us that this was, amongst the most egregious policies that we've ever seen in this country. It's certainly the most egregious policy that I've ever seen in my life as a pediatrician. And our program has took care of at least about 30 children who were separated from their parents. And I'll tell you about one of those stories in a minute. The actual number now is 4,000 children, because they're including children that were affected beyond the zero tolerance policy. About 500 parents were deported, and I myself spoke to one of the mothers of a child that I saw in my clinic who was living in Guatemala after being deported after she was separated from her child. The ACLU took on this case, and some of us in our program wrote declarations to support this case, so we were very proud that the ACLU prevailed. Even as of 2018, there were 900 kids that were not reunited with their families. And today, there's still hundreds of children that have not been reunited with their parents. And so if you think of the toxic stress model and the irreparable harm to children that this policy has done, you just think about the principles that we're talking about and how this goes against everything that we believe in. So Dibera Arzu was a woman, a Garifuna woman, from the coast of Honduras who came to the US in 2018. She was a single mother and found out that she was, a year before she came, that she was HIV positive. Unfortunately, her community also found out that she was HIV positive. Honduras and the Garifuna community has one of the highest HIV prevalence rates in all of Central America, and possibly because many of the men are merchant Marines who go out and go all around the world. So she began to get death threats and knew that if she didn't leave, there was a very good likelihood that she'd be killed. She was apprehended in Texas, and unfortunately, she arrived in 2018 as zero tolerance policy was put into place. Dibera was sent to Seattle, and her two boys were sent to a shelter in New York, in the Bronx, as a matter of fact. Once she got released, she came to New York to look for her children, and she was referred by family members who were also part of the Terra Firma program to get help. And so we referred her to her lawyers to help her get her children out more readily from detention. When we saw the family, they were totally distraught. The mother couldn't stop crying. One of the boys had selective mutism, and one of the other boys had severe depression. This is the US policy, and this is what it's done to families. I'm going to tell you one other story about my experience at the border. So in 2018, a huge caravan of Hondurans, mostly Hondurans, came to the US. And they came as a caravan because it's much safer to travel through Mexico with a caravan of people or with a big group of people. You're much better protected. Two of the boys that were in that caravan, Jason and Alexander, and these are real names, and you could read about it in The Guardian or other articles, were arrived. And, I don't have all the pictures, but there were migrant camps set all over Tijuana, right? And so I went with a delegation of from UNICEF, Kids in Need of Defense, and Terra Firma we went to really look at what was happening in the migrant camps and whether kids were getting the health care that they needed. Some of those kids were lucky and ended up in a youth center that was run by the YMCA. This is sort of what it looked like. The tents on the bottom is one of the migrant camps, and that was in the Benito Juarez sports arena, where sports center, where migrants just set up these tents to live, and the conditions were really horrendous there. So these two boys fled violence in Honduras. Gangs were after them, and they came to the US for freedom and to reunite with family members. Unfortunately, they were the victims of a US policy called Remain in Mexico that was not supposed to affect unaccompanied minors. Unaccompanied minors were exempt from that rule, except the Border Patrol people didn't know that or didn't follow those rules, right? So they were not allowed in the US and had to stay for about a month in Tijuana. At one point, they were lured into the center of Tijuana. They were kidnapped. When the kidnappers realized they had no money, they started to extort their families. There was 3 of them. One of them escaped, which is how we know all the details of the story. Unfortunately, 2 of those boys were killed. And I tell you this story not to horrify you, but to tell you what the real, true effects of US policy are on children and families in the world. So we'll try to apply some of these principles to what we do in our real life. We'll talk about the migration framework that I mentioned earlier. We'll talk about the intersection of medicine and immigration law, and we'll talk about Terra Firma. So I like to think of primary care. This is a hospital-based lecture, so I'm in the community. I think primary care is, maybe to use an old phrase, where it's at. And it's just an incredible place to be in primary care, to be in the community, embedded in the community, on the street, to go out in the community, to eat with the community, to see them play sports, and whatever it is, it's an incredible place to be. And primary care is so great because primary care can take place in all different kinds of ways, in schools and health centers, and in this case, on a mobile medical unit. And we developed these mobile medical units to serve families living in homeless shelters. The other thing primary care does is it acts as a sentinel. We see what's going on in the community before anyone else does. We see what illnesses are arising. We see what environmental changes are. We could see what new populations are. And so I was working on one of these mobile units with our psychologist and our 3rd co-founder of Terra Firma, Dr. Cristina Muñiz, who we were providing care to homeless or unhoused street youth at a drop-in center in Harlem. And we had a boy from Guatemala brought onto our mobile unit who had very severe mental health illness. And the only thing he had on him, the only thing he could tell us about himself was he had his attorney's card. He has Brett's card, right? So we called Brett up, and Brett explained to us that this was an unaccompanied minor. And we were like, what's an unaccompanied immigrant minor? So an unaccompanied migrant child, there's a lot of different ways. Unaccompanied immigrant children, the federal government calls them unaccompanied alien children, are children under the age of 18 with no legal status in this country and have no parent or legal guardian at the point of apprehension. Okay, this really applies to children who are not from contiguous countries. Children from Mexico or Canada have to prove an asylum claim and to be able to follow these, to be able to stay in this country. But the vast majority of kids we see come from Central America. And then migrant families was the other population we began to see, especially in the shelter system that our health center, our community health center was serving. And so these are legal guardians, parents with their children at the time of apprehension. And most of the time, at least until recently, most of the time, it's women with young children. And the reason it's women with young children is because the level of gender-based violence in these countries without protection is astounding. So I want to just show you a little bit about the numbers. And also I want you to just think about those deterrent factors that I talked about and how they really don't work. So we started our work in 2013 at Terra Firma. That's when Terra Firma was first founded. And you could see there was about half the number of children that came into this country compared to 2014, which is when Obama declared the crisis at the border, a humanitarian crisis. And we saw close to 68,000 children, unaccompanied children at the border. Since that time, the numbers sort of stayed pretty steady until about 2021, where you could see there was an enormous rise in the number of children. And one of the things you'll also start noticing is that there's an increase in children from outside of the 3 countries in Central America and Mexico. In 2021 and 22 together, we saw over 300,000 unaccompanied children. These are family units, right? Think about family separation, all those things at the border I talked about that happened in 2018. Look at the numbers, they're not deterrent. Okay, we've seen over 1 million, almost getting close to 2 million family members in the last 3 years. So let's talk about the framework for really caring for these children. And the steps are important because different aspects in each phase of their migration affects their health, affects the way we have to take care of them, and affects their legal case. So we think about this as what happens in their country of origin, what was their life like? Did they have health care? Did they have medical problems? What made them flee? Did they have education? Did they work? All the things, who did they live with? All of those, think of the social history. We have to take a social history 4 times, right? So the migration and the journey, and we'll talk about that in a second. What happens when they're apprehended and detained? And lastly, what happens, what's their life like when they're released into the community, reunified with family members, and are waiting for their deportation hearings to occur. It's always important to remember that last aspect. So the push and pull factors, why children come to this country, why families come to this country. Sarah pointed out to me yesterday the incredible disparity of the push and the pull. You know, we talk a lot about people coming just for economic gain, but look at these push, and these are the push factors that we see in every patient that we talk to, right? So this becomes real in the histories that we take from the patients that we care for. So most of the kids start off in abject poverty, which means that there's social exclusion, they don't have access to jobs, to full education, and most importantly, to protection. There's incredible gang violence and criminal activity because there's vacuums of power in this country. And so those gangs, those international gangs, transnational gangs, actually take control, right? Right now in Honduras, in El Salvador, which had really some of the highest levels of homicide in the world. We have a president right now, Bukele, who has put almost every gang member in jail, and crime has plummeted, but think of the human rights, right? So we think about public health and human rights, and that's sort of, now we're seeing jails completely full of young people in El Salvador. For us at Terra Firma, really gang violence, gender-based violence, and actually domestic violence and child abuse are the main causes that we see, at least until this recent surge of immigrants. And I'll talk about that in a minute. They have to make this incredible journey, thousands of miles to the US border. So this is a picture of, you can see a lot of young people in the back of a truck, and we've all heard the stories of people that is, migrants that have asphyxiated in the back of trucks. Many of them ride on the tops of trains called La Bestia, or the Beast, through Mexico. And you know, they really are subjected to incredible hardship along this journey. So again, think about the traumas that's happened in their home country that led them to flee, and they have to make that decision to flee, whether on their own or with their families. Many kids that we see say they left their homes without even telling their parents because they were afraid they would be blocked from leaving. And then they have to take this journey. And think about that when they get to the border, right? This is just a slide that talks about most recently the surge in migration, which is predominantly Venezuelans, although we are seeing people from the Western Hemisphere and from West Africa. These are pictures through the Darien Gap. So in most of the migrants that we've seen up until now are traveling from Central America through Mexico. Now you're having migrants that either come from other continents into South America, have to cross the Darien Gap, which is the jungle that separates Colombia from Panama, right? And then make their journey all the way up again to the border. This article is really incredible because it talks about how this route, which was really almost unnavigable prior to the last few years, which migrants did take and really at their own peril, and many died, have become sort of like a commercialized. And now they have really like tour leaders that are taking big masses of migrants through the jungle, which makes the trip a lot safer and better. But as you can see, you know, it's still incredibly arduous. So either there's too much water or there's not enough water. And the perils of crossing the border are great. I think this year, those past year, fiscal year 23, I heard that 800 migrants were found dead at the border, either drowned or dehydrated in the desert. And now, if you remember the news recently, when you see this river, Texas put up barbed wire in the river on floats so that migrants cannot actually get there. They'll still try and they'll get injured and they might die. But that is the federal courts found that struck down that ability for them to do that. But just think about the way we're treating these human beings. They're apprehended and detained. And so what happens is really all of the children and families we see, they're not trying to escape authorities. They want to get found by authorities and then processed. Right. So this is a picture from the New York Times a few years ago of a child being apprehended, and you can see how young he is. And we do see children sometimes as young who travel alone. And this is what's called often called la hielera, or the icebox, right? Which are these freezing cold, really warehouses where migrants are kept while they're being processed. All of those silver blankets are actually human bodies underneath that are, that are either sleeping or resting from their journey. And I've been to these. I went with the American Academy of Pediatric presidents, Dr. Dreyer and Dr. Stein. We went on missions there, and actually that going to these detention centers allowed us to write our, helped us write our policy statement. This is what happens next. So unaccompanied minors get put into the Office of, go under the custody of Office of Refugee Resettlement under Health and Human Services, right? This is a better step. They're treated better, and we want unaccompanied minors to go directly there and bypass the Customs and Border Processing Centers. So a picture below is a very large shelter that you can see. And in those, there is shelters in 17 states. There's now over 10,000 beds. And when there's overflow, they set up these big tent camps. And I've been to those tent camps in the desert where kids are then sent. They get better medical care in these facilities, and they start their medical intake, and they do get mental health screening. When you see these kids in your practice, ask for the package that they get released with, because you'll get all their immunizations, you'll get their quantiferon, their TB screen, you'll even get some other testing if they were lucky enough to get that done. Family units, on the other hand, get put under ICE. Immigration Customs Enforcement, right? And there had been 3 family detention centers, of which I've visited every one of those and interviewed multiple families in those detention centers. 2 were in Texas, and 1 was actually in Pennsylvania. The picture above is Dilley Detention Center, probably the largest detention center for families in the world. Over 1,000 people were in that detention center. Brett and I both were down there, and we're doing interviews with families so that they could get them prepared for their credible fear interviews. So what happens next is either they get a credible fear interview to say, do they have reason to be in this country and fight for protection and legal status? If they don't, they could appeal their case. If they don't win, they get deported. And while they're waiting to get their appeal, they languish in these facilities for a very long time. In the Pennsylvania detention center, families were there for over a year that I'd seen. and the effects on their children's health and their mental health was incredibly deleterious. So unaccompanied children then get released to a sponsor. So this is the process. And that sponsor has to be vetted. New York State has one of the highest number of children that get resettled or reunified here. About 50% of sponsors are parents, and the rest are adult, mostly adult relatives, family, friends, and a very small percentage end up in the foster care system because they have no one to sponsor them. So I just want to talk just about recent events, because I think, it's on a lot of our minds. So as of April 2022, the border states, Texas and Arizona, as well as Florida, began sending migrants that were released, families and single adult migrants that were released from the detention centers to sanctuary cities throughout the US. This is an incredible political ploy, right? And so what we've seen now is in New York City, over 126,000 migrants in a very short period of time. Okay, yes, maybe the rest of the country should share the burden of what's happening at the border, but to happen so suddenly without preparation, the border states get billions of dollars to care for migrants. New York State doesn't get anything, right? So it doesn't make any sense, right? And so now we're left with the crisis that we're in right now. In the New York City shelter system, over 64,000 migrants have been placed in that shelter. Terra Firma is now going to those shelters and either giving comprehensive primary care or immunization drives and connecting them to care. And so that's something we've been doing in the last 9 months. The Mayor Adams recently just declared that he was going to have a limit of stay in the shelters for up to first 60 days, and then it went down to 30 days for single migrant adults. And now he just announced that the same thing was going to happen for families. This will create an enormous humanitarian crisis right here if that happens. And we have to all fight and call our government officials to prevent that from happening. They want to set up a huge migrant camp in Floyd Bennett Field. And 20,000 children have entered the New York public school system, and I know they're looking for about 300 ESL teachers right now. The welcoming of migrants has been mixed. A lot of humanitarian and immigration rights groups have embraced the migrants, have gone to the welcome centers and really helped them. But you could see on Staten Island that they were met with incredible, hatred. Okay, so now it's time for a little healing, right? It's been pretty ugly, I have to admit, but we have to know about this, right? What we used to say in the 80s is silence equals death when we talked about the AIDS crisis. So let's talk about healing. Humanism in medicine. I'm really glad that someone from the foundation is here today. I didn't know that, so this was as fortuitous. I'm not going to go through all of these elements, but we learn these principles like in our first week of medical school, and a lot of us are a lot further past our first week of medical school. So I think it's just worth going over these issues: integrity, excellence, collaboration and compassion, altruism, respect and resilience, empathy, and service. I'm not going to necessarily explicitly talk about how all of these things are in our program, but I would like to think that a lot of these elements are implicit in the program that we develop, Terra Firma. So Terra Firma was founded in 2013, at first to address the complex needs of unaccompanied children. But soon we realized that we really had to take care of families as well. My co-founders were Brett Stark, our immigration attorney, who was working at Catholic Charities at the time, and Christina Muniz, one of our psychologists. To date, we've served over 1,250 children and families, members of families. You can see the numbers here. We have to do our work in partnership, so we cannot do this work alone. We have a referral-based program, so we get them from this wide range of our partners. And we also work with other partners to help youth enrichment and cultural activities for the kids. And that's a picture. It's It's weird, this is a photography program and it's a very blurry picture, but this was our first workshop working with the International Center for Photography. And this is a group of one of our first cohorts of kids who participated in that, learning the principles of photography, going out into the community, taking pictures of what they saw about their new life in New York City, and then presenting them to all of us. I will assure you there was not a dry eye in the house, and the work that they produced and then had to speak about their work was just so incredibly impressive. So these are some of the principles, and I'll talk about the principles, but I have to tell you that, like, the principle, when you talk about the principles, it's so dry, but when you go to the health center, it is the furthest thing is from being dry. It is an incredible beehive of activity. And at one point, maybe in our insanity, we decided that we would do Zumba in the waiting room with our executive director, who's in the middle of this slide, Debbie Snyder. And these are the families and children dancing Zumba in our waiting room. We weren't able to sustain it, but boy, was it fun. And actually, the New York Times came when we were doing this, and that's where this picture came from when they talked about our program. So a couple of the key principles of our program. First of all, it's a wraparound program. We wanted migrants who are new to the city to go to one place at one time to get all their services. We didn't want them running all over the place to get the things that they needed, right? So we integrated a legal team within the health center, working side by side, pediatricians, nurse practitioners, social workers, psychologists, case managers. Right. And so we would all be working together. Families would come, they'd get multiple services at one time. There might be a cooking class, there might be a support group running on. These are all the things that are happening. We used a medical home model, and we use the medical home model because we know that the children that we see in our practice are not, you cannot use this sort of forensic model where you do an evaluation and then get the information you need, write an affidavit that goes to the court to help support their immigration case. That we knew we were not going to get stories from kids by just seeing them once or twice in our clinic. So we really wanted to enroll them into our health center. We knew they'd be living for years in our community, and we really wanted to watch them grow and develop and also build their trust so that they could tell us exactly what happens. When they're talking about physical or sexual abuse or violence that was portrayed against them, for children, this becomes incredibly difficult. And so the medical home model was the right model for us, and we stand by that. We're a referral-based program, so we get referrals from legal agencies, pro bono legal agencies, nonprofit legal agencies all over the city, from schools, from other health centers, from community-based organizations like a Garifuna church in our community in the South Bronx. And really now, from word of mouth, all the migrants are talking to each other and saying this is a safe place to come, so this is where you should go. We like to think we're trauma-informed across all of our domains. You know, we're not always perfect in this, but this is what we strive for. We're a strength-based program, but we never think of our patients as victims. They don't think of themselves as victims. And I would say that they are some of the most resilient children I've ever seen in my life. And then the healthcare nexus. How can we in medicine work with the legal partners to improve the outcomes of immigration cases, right? So we have a role in being able to get stories that a lot of times the lawyers can't get because we're trained to get these stories of trauma. And then we could put this information, whether it's physical evidence or evidence of mental health problems through screening and through treatment, and we put these into affidavits that then become part of the immigration case. And I will tell you that when I sit in a courtroom and I testify or I hear the evidence presented about the medical evidence or the mental health evidence that we provide, you could see how the judge just completely transforms. And so we have an important, very critical role. And I would say that even if you're not doing this work specifically, you should always ask your patients if they have a lawyer, because they need a lawyer to really be able to win their case. It is incredibly important. And we'll see that in a minute. So this nexus is just critical to our work. Youth enrichment is critical to our work. The kids don't care about their immunizations or their TB screenings or their mental health screenings. They want fun. These kids haven't had fun in their life. They haven't had freedom. They want to play soccer. They want to be introduced to the arts. They want to go on field trips into New York. So this becomes really one of the most important aspects of our work. And advocacy is absolutely 100% built into the work we do. In fact, everything I talked to you about today, I've learned from the kids that I've taken care of, or the families that I've seen in detention centers, or what I've witnessed in my own eyes from migrants who I've met along, in my work. So we become advocates. We become the voice for those children. And physicians have a very important role, or other healthcare providers have a very important role in that. So these are some of our domains. I don't know how much time I have left. Probably I'm over already. How are we doing? 2 minutes. Okay, move along. I'm getting the move along sign. Okay, so these are the key elements, and I really think I've touched upon most of these. So immigration attorneys improve legal outcomes, right? Migrants who are appealing for to stay in this country have no right to legal representation, right? From 2015 to 2017, about 70% of kids had legal representation. That number was a lot lower if you just looked at like the 2016 numbers, right? iCare is a network of nonprofit legal agencies in New York City that provide care to children, and they've represented 2,700 children to date. With an attorney, about 90% of children win their case. Without an attorney, only about 20% win their case and get deported. So think about how important that attorney is in their future. Healthcare providers, right, also can improve legal outcomes, right? So this is a study that was done by Lustig with adult asylum seekers with a medical evaluation. They won 89% of the time, right? 38% without a medical affidavit. And these studies have been replicated by Physicians for Human Rights. And I'm sorry, I don't have that study up here. We have the ability to write medical or forensic evaluations, written affidavits, and provide oral testimony. We uncover histories that were not revealed prior to their lawyers. Oftentimes, we can improve communication with their lawyers, and we can prepare children to be in court, right? And think about maybe the child protection model. For us at Terra Firma, we've written about 231 affidavits. Of those who have gone to court, 45% have won, 55% are still pending. We have not seen one case lost in a case where we've written an affidavit. So I like to say 1,000 children, 1,000 stories. Again, I sort of made that point, right? We are the eyes and ears of what the children and families tell us. We witness the effects of public government policy. We learn from the community we serve. Our job is to share what we have learned and act on what we've learned. And so this is some of the work that has been done. There's the policy statement that Dr. Orange mentioned. This is Vulnerable But Not Broken. Some of our psychologists in our program participated in writing this, and this was about separation of children and the harms that it caused. There's a picture of a recent picture that one of the children who are recent migrants who are living in one of the shelters drew for us. And this is the team working on the mobile unit. So last slide. Medicine is humanitarian work, and we should always strive for practicing humanism in patient care, program design, and self-care. I'm terrible about talking about self-care. I apologize. We could talk about that at the workshop. As advocates, following the principles of health, equity, social justice, and human rights will always place us on the side of right. Our best teachers are our patients. You all know that. We must always speak truth to justice, or as we used to say, as I've already said, silence equals death. Immigration status is the social determinant of health. So this is really important for us to remember this in our work. We can be agents of change simply by connecting our patients to immigration attorneys to see outcomes that will change the trajectory of their lives. Deborah Arzu, the woman who had the 2 children, received comprehensive HIV care. She's seronegative now, or her viral load is undetectable, sorry. Her children have pediatricians, and after 3 years of mental health care, they're thriving. The family has a lawyer and their asylum case is currently pending. Jose had a pediatrician since arrival. He's now in adult care and received 4 years of intensive therapy for PTSD. Last year, he won his immigration case. The US continues policies that dehumanize migrants and place their health and well-being at considerable risk. The concept of comprehensive immigration reform legislation is not even on the table. We got to remember this last point in our own work as advocates. Thank you so much for inviting me today.